You're welcome. Hello, beautiful people. You're welcome to my live stream. You're welcome to my live stream. Please, let's come around. Let's come around. Let's come around. All right, let me quickly type the topic. Hey, the topic is the necessity of PAP test and my personal experience. Yeah, so let me quickly type the topic, please. Yeah, the necessity of PAP test and my personal experience. The necessity of PAP test and my personal experience. Yeah, that's the topic for today. That's the topic for today. Please let me quickly share myself out. Please, let's come around. Let's come around. Thank you so much. Thank you so much. Want to talk about PAP test. Yeah. Please, let's come around. Want to talk about PAP test. Don't forget to give your host a thumbs up. All right. Please, let's come around to talk about PAP test, the necessity of PAP test, and my personal experience. Please, let's come around. Let's come around. I'm trying to inform others that we are live already. Yes, we are live already. The necessity of PAP test and my personal experience. Let me try to tell others that we are live already. We are live already. Thank you so much for this thumbs up. Thank you so much for the thumbs up. The necessity of PAP test and my personal experience. Thank you so much. Thank you so much for coming around. Please, let's come around. Let's come around. The necessity of PAP test and my personal experience. Don't forget to give me a thumbs up. Thank you so much. We have 4 amazing people in the building already. Thank you so much for coming around. The necessity of PAP test and my personal experience. Okay. Thank you so much. Thank you so much. Okay, so greetings to everyone. Good morning, good afternoon, good evening. Please let me work on my volume. I hope my volume is all right. Let me increase my volume. All right. So, PAP test. What actually do I mean by PAP test? Now, Georgios Nicolaou Papanicolaou happened to be a Greek physician who was a pioneer in cytopathology and early cancer detection. And he is the inventor of the PAP test, also referred to as PAP smear, which was named after him. So some people call him Dr. PAP, and most times we say, oh, I have a PAP test. It is actually from the name of that physician. His name is Georgios, is a Greek, so Georgios Papanicolaou. So we say, oh, I have a PAP test. So this test is a procedure that is used to test for cervical cancer in women. It is PAP test or PAP smear is used to test for cervical cancer in women. You know, October happened to be the world cancer, but for one reason or the other, we're not able to take any topic on cancer. So it is never too late. That is why today we are talking on cervical cancer. And let me start. I'm going to be answering some questions. So my first question is, what is PAP test? What is PAP test? Now, PAP test is a method of screening, is a procedure that is used to detect potentially cancerous cells and cancerous cells. Now, we have cells all over the body. Cell is the smallest, simplest unit of life. So this test is used to detect, future cancerous cells, potentially cancerous cells, and even cancerous process in the cervix or in the colon of women. And abnormal findings are often followed up with for further tests, further proceedings. Now, what do I mean by the cervix? The cervix is the lower end, that lower end of the uterus of a woman. That is the cervix. It is that junction between the uterus and then the birth canal. When a woman wants to give birth and the midwife says, "Oh, I can now see the head of your baby." That means the baby have descended down the cervix. So that cervix is that lower end of the womb, or we call it the uterus of a woman. So that is pap test. It is used to detect if there are cancerous cells, or if there are some abnormal cells in the cervix of a woman. So why is pap test necessary? It is necessary for women. Pap test is for women. But if you are watching me right now and you are a man, don't say, "Oh, I don't need this, it's for women." Yeah, please try to watch to the end, because you like to share it with your wife or your mother or your sister or your friends. So please try to also come along, whether you are a male or you are a female. So why is pap test necessary? Now, detecting cervical cancer early enough is the first step in altering the process, the chance, of a woman developing that cancer. So the altering the process is the first cure to cervical cancer itself. Early detection is the first step in altering the possible development of cervical cancer, because this test can detect the changes in the cells that suggest cancer may be developed eventually in the future. So this test is so effective that it could detect the changes in the cells around the cervix of the woman. So it is necessary to go around, call your doctor, call your midwife for pap test. So my next question is, how is it done? Yeah, how is it done? Now, the pap smear, or often called the pap test, is usually done in conjunction with a pelvic exam, and in women older than age 30 years, it may be combined with another test referred to as HPV test. HPV is Human Papilloma Virus. So that's the meaning of HPV. So in women older than 30 years, pap test could also be combined with HPV test. And HPV is a virus that is commonly transmitted during intercourse. So it's a common sexually transmitted infection that increases the chance of cervical cancer. And in some cases, it could be substituted with pap test. Yeah, sometimes HPV, human papilloma virus test, could be substituted with pap test. And a speculum is just introduced into the woman, and then there are some tools that are used, like a brush could be used, a spatula could be used to collect the cells from the cervix of the woman. At the same time, others use a device called cytobrush. Cytobrush, it is the combination of both the spatula and the brush. They are used to collect the cells from the cervix of the woman. So it basically involves collecting cells from the cervix of the woman. Now, like during my own experience, the spectrum was introduced, and then my gynecologist, used the spatula to collect the cells. So actually, it's not painful, because my next question is it painful? It's not painful, but it might be mildly uncomfortable. Yeah, mildly uncomfortable. Yeah, I was like, "Oh," she was like, "Oh, what is it?" I said, "Oh, it's actually my first time." According to the letter I was given, it's from 24 years old to 25 years old to 64 years old in this very country where I am. But All this while I've been expecting the letter, but the letter never came. I was like, oh, one day I know the letter will come. So the letter eventually came last month, and the test was to be done this month. So it's not actually painful, but it's mildly uncomfortable. Yeah, you feel uncomfortable, and it doesn't take long. Yeah, it just take a few minutes, just like 2 minutes, 3 minutes. And funny enough, my gynecologist was communicating with me in order to relieve the stress. And before I knew what was happening, she said, "Oh, I am through already." So it's not painful, but it's mildly uncomfortable. Yeah, that is all the truth of the matter. So the next thing is the age. Next question I have here is age recommendation and how often should it be? Now, when it comes to the age now, for females less than 21 years, from 1 year to 20 years, you don't actually need a pap test. You don't need a pap test or a pap smear. But from 21 years old and above, yeah, you need to start registering for pap test. So from 21 to 29 years, doctor recommends that females should begin pap test every 3 years. So from if you are 21, 22, 23, 24 to 29 years, every 3 years you are recommended to go for a pap test. That is once in 3 years. And from 30 years old to 65 years old, every 3 years the same thing, you are recommended. It's good for you to go for a pap test. But from age 30 years old, HPV test could be also connected, could be carried out along with a pap test, like I said the other time. So from 30 years and above, you could have both pap test and HPV test simultaneously. Okay, and that is also once in 5 years. So when you have both pap and HPV, it's once in 5 years. If it is only HPV, like I said the other time, HPV alone could be used to substitute pap test. So HPV test is also once in 5 years. So it doesn't cost you anything in once in 5 years to undergo this 2 minutes test, or once in 3 years to undergo this 2 minutes test that is very meaningful to you. Now, for those above 65 years now, you may feel, oh, I don't need this test any longer. After repeated routines that test negative, for those above 65 years, they may feel they don't need the test any longer. Now, apart from that too, for those above 65 years that are not probably sexually active again, they may feel like, oh, I'm not sexually active again, so I don't really need this test. You understand what I'm saying? So 65 years and above, one could say, oh, I don't need a pap test any longer. At the same time, we know there's something called hysterectomy. So at the same time, after a total hysterectomy, which is the surgical removal of the uterus, including the cervix, a woman could say, oh, I don't want to go through pap test again because the uterus is no longer there. Uterus in the womb, like the uterus is no longer there, or the cervix is no longer there. So those are the two exceptions for one not to partake in pap test. Now, subsequently, more tests could be recommended. Yeah, more frequently. I said the pap test is once in 3 years. If it is pap and HPV, then it is going to be once in 5 years. If it is only HPV, it's also going to be once in 5 years. But it could be more regular than that. Number one, if the diagnosis showed precancerous cells, yeah, if the diagnosis of the results shows that, oh, there are precancerous cells in the cervix of that woman, then the test has to be more frequent. Number two is if the person has been infected with HIV before, human immunodeficiency virus. Now, what HIV does is that it weakens the immune system. And don't forget that it is the immune system that helps to fight against infection, fight against virus. And when the immune system of a woman is weak, then human papilloma. Oh, thank you so much for coming around. Temitope Modupe Father say, thank you. I can see you. Mercy, I can see you. Olaoluwa, I can see you. Thank you so much for coming around. So, if someone that has been infected with HIV before, more the person could be the HIV could damage the immune system of such a person, and with that, any virus that enters such a person will be able to thrive easily. At the same time, weakened immune system due to organ transplant. Oh, IJ Kitchen and Health Channel. Hi, host. Thank you so much for coming around IJ Kitchen and Health channel. Thank you. I'm talking about pap test. I'm talking about Baptist. Thank you so much for coming around IJ Kitchen and Health channel. So I'm talking about pap test and my personal experience. Actually, I have been waiting for a pap test all this while, but eventually I got my invitation last month, and today I'm talking about just like a cervical cancer awareness. So I've mentioned why pap test is necessary. I've talked about what pap test is all about, just a procedure in checking precancerous and cancerous cells in the cervix of a woman. And I've also talked about how it is being done. It's such a simple procedure, just with a spectrum, spatula, and a brush. IJ Kitchen and Health channel, when last did you have a pap test? Have you had any pap test of recent? So I just wish talk about the age recommendation to less than 21 years. You don't need a pap test. From 21 to 65 years, you actually need a pap test. Okay, so I was saying that the test is pap test is once in 3 years. HPV, Papilloma Virus test is once in 5 years. And I said it could be more often depending on some factors like if the diagnosis showed precancerous cells, if such a person has HIV. Oh, last week, wow! IJ Kitchen and Health channel did as last week. Wow, we did ask, just about the same time. That's interesting. That's good to know. That's good to know. So number three is that if someone has a weakened immune system due to organ transplant, due to chemotherapy, or due to chronic corticosteroid use, or even if a woman has history of smoking, so such a woman could be subjected to more frequent pap test. Thank you so much, IJ Kitchen. Thank you so much. So my next question is, how does one prepare for a pap test? How do you prepare for a pap test? For a most effective result, number one is avoid intercourse, douching, using of spermicidal jellies or foams. Spermicidal means jellies that could kill sperm, or foams, creams that could kill sperm. So you avoid the use of all those things because they could wash away or obscure, just kind of block the view of normal cells. And number two is try not to schedule your test while doing your menses. Yes, what they need is the cells in the cervix, so menses could disrupt them. You understand what I'm saying? So thank you so much for coming around IJ Kitchen. So other basic, things you need to put in place will be listed in your invitation letter, just like mine was listed in my invitation letter. So now the big question is, how does one even register for a pap test? Like I said myself, I was expecting this letter for some times, but my letter arrived last month. So if you find yourself in a country, where nobody even calls you for pap test, 5 years, 10 years, maybe you are 30 years old, you are 40 years old, and it's like, oh, have you had a pap test before? And the answer is like, what is pap test? You, as a female, you need to talk with your doctor. Might need to give your doctor a call and say, I need to do a test I just heard about called pap test or pap smear, especially if you are sexually active. Like I said, HPV is from 30 years old. HPV test is from 30 years old because it is assumed that from that age you are sexually active. Although some people get married before even getting to that age. And for young people, they are not even up to 21 years, you are engaging in sex already. You are increasing your chances of developing, cervical cancer. So now, after the test is conducted, after those cells are taken, they are taken to the laboratory for the laboratory procedures to be carried out, and then the result comes out as either positive or negative. So if the cells found in the cervix are all normal cells, the result comes out as negative. But if the cells, if abnormal cells are discovered, then it comes out as positive. And with this, the doctor, your gynecologist could subject such a person to further tests, subjects a person to further tests in order to attack the situation on time. So pap test is used to detect cancer early. Is for early cancer detection. Cancer is one of the leading is one of the leading illness in the entire world that causes death. So want to prevent cancer as much. Nobody pays for cancer, but you also have to play your own role by going for your pap test regularly. So what is cervical cancer now? What is cancer itself? Cancer is a disease in which there is outgrowth, abnormal outgrowth. The body grows out of control. The cells in the body, abnormal outgrowth of the cells in the body when they go out of control. And cancer is normally named according to the part of the body where it starts from. If it starts from the breast, it is called breast cancer. If it starts from the kidney, it is called, oh, this is kidney cancer. If it starts from the cervix, then it is called cervical cancer. So depending on where those abnormal cells starts growing from, and the one I just talked about, cervical cancer starts growing from the cervix. Now, all women are at risk of developing this cancer more often when we are over the age of 30 years old. And that is why the best way, the only way to reduce your risk is to have a regular screening. Have a regular screening from age 21 years. So what is actually the main cause of this cervical cancer we are checking for? The long lasting infection, in cognizance with certain types of HPV, human papilloma virus, is what is mostly responsible for cervical cancer. And like I said, this virus is a common virus that is passed from person to person. However, it is not infectious. So it is not like COVID-19. When someone has cancer, when, for example, if a woman has HPV now, it doesn't mean that when you greet her or when you talk to her, oh, then you also will contact cervical cancer or you get HPV. No, it is not like COVID-19. So other factors that could result into cervical cancer is other factors that could increase a woman's risk of developing cervical cancer includes immune system deficiency. Like I said, immune system is to help to fight foreign particles, but if the immune system is deficient, maybe the cells of the immune system are weakened, then that is an issue. Number two is a history of smoking in women too. Gifty daily gifty daily motivations. Hello, beautiful host. Oh, thank you so much for coming around, sis. Oh, you actually came late. I'm already I'm halfway gone already. Thank you so much. I appreciate you for coming around. Thank you, sis. So I'm talking about the main cause of cervical cancer now. And I said number one is a long-lasting infection with certain types of HPV, human papilloma virus. So if you are a woman, you have infection, you shouldn't take it for granted and just say, it's an infection. No, you need to get across to your doctor, you need to get across to your gynecologist. Other factors that could, oh, I'm so sorry, dear, was okay, all right, sis, all right, sis. So other factors that could raise a woman's risk of developing cervical cancer is immune system deficiency, smoking, history of smoking, socio-economic factors, the way of life of such a person, and oral contraceptives too. So for someone who is always going from one man to another, just keeps jumping about like a beach, such a person could also is have an increased risk. Oh, fantastic, Efe. Wow. Fantastic, Efe. Thank you so much for coming around. Thank you. I appreciate you. Thank you for coming around. I'm talking about pap test, although I'm more than halfway gone already. I'm going to upload this video when I am through. So please, you can stay around with me and also watch the repeat broadcast. So I've talked about the main causes of cervical cancer. Now, the next question I have here is, what are the symptoms? Lizzie Love TV. Lizzie Love TV, you're welcome. Good afternoon, everyone. Lizzie Love TV, you're welcome. I'm talking about pap test. Pap test is also referred to as pap smear, and it's used to detect precancerous cells in the cervix of a woman, used to check for cervical cancer in women. So I'm talking about the symptoms of cervical cancer now. And at the initial stage, cervical cancer, the symptoms, the signs are not really visible at the initial stage. But when it gets to a more advanced stage, then the symptoms could start becoming glaring. And number one is bleeding after intercourse. When a woman bleeds so much after intercourse, bleed so much between periods or after menopause. Now, menopause, when a woman enters menopause, she's expected to stop menstruation. But when a woman enters menopause and she's still bleeding profusely, bleeding regularly, such gifted daily motivation. Wow, it is very important for every woman to check this out. Gifted daily, when last did you have your pap test? Oh, thank you so much, fantastic Efe. Gifted daily motivations, when last did thank you, fantastic Efe. When last did you have your pap test? Yeah. So bleeding after intercourse, bleeding between periods, or even after menopause, when the woman is still bleeding, then that woman needs to check the doctor. Another thing is watery bloody discharge. Watery bloody discharge, that may be heavy and also have a foul odor, stinking odor. Such is also another advanced symptom of cervical cancer. Another thing is pelvic pain or serious pain during intercourse. Pelvic pain or serious pain during intercourse is another symptom of cervical cancer. So you really need to get in touch. Oh, gifted daily motivations. You need to call your gynecologist or your doctor. I'm now planning to go and check it out. Okay. And tell her or him that you need a pap test. No one wants to get cancer, but it's good to take all those precaution. So like I said, the way to reduce your risk is to have a regular screening. Have a regular screening, and the result comes out. If it's negative, you are good to go. If it is positive, if the pap test comes out positive, then like I said, such a person is subjected to further tests. And if further tests are carried out and the person is confirmed positive for cervical cancer, then depending on the type of cervical cancer and how much it has spread, the treatment begins. It could be just an operation, surgical operation. It could be chemotherapy. It could be radiation therapy. Depending on the type of the cancer and how much the cancer have actually spread. So I don't know if you have any question for me. Lizzie Love TV, do you have any question for me? Gifted Daily Motivations, do you have any question for me? Who else do we have here? We have Temitope Modupe Fadansi here. We have Mercy here, Mercy Fadansi. We have Olaoluwa here. So do you actually have any question for me? I wouldn't want to repeat what I've said so much because I have, like I said the other time, I've gone almost halfway before you came in the other time. Gifted Daily Motivation. So if you are in a country you've not received a letter for pap test, you need to get in touch with your doctor and with your gynecologist. And like I said, even if you're a man, you are watching this right now, don't say, oh, I don't need it. You might need to inform your wife. You might need to share this video with your wife, with your friend, with your sister. You understand, with your niece, and tell them, hey, when last did you have your pap test? I was so happy when I got this letter for my pap test. So do you have any question for me? Let me check if you have any question before I go. Okay, she said no. All right. So in my last episode, I please, if you have not been watching my previous episode, please, if you are watching me and you are new to my channel, thank you so much for coming around. Thank you for coming around. And if you are familiar with my face, my viewers, my subscribers, please, thank you. I appreciate you all for always coming around. I talked in my last episode, I talked on how stress could make one to lose hair. Can you imagine? Yes, stress could push your hair into resting face. Because oh, Mommy T and V, IO, thank you so much for coming around. Eva MCG, good afternoon, beautiful. Well done. Thank you so much. Thank you so much, my sister. I just finished talking about pap test, also referred to as pap smear. Oh my. Yeah, I just finished taking the class already. So happy weekend, everyone. Mommy T and B is saying happy weekend to everyone. So please you might just try to watch it while I upload it. So I was talking about that the my last episode I asked that I asked a question in my last episode, and I said that oily, slightly waxy substance on the skin, what is it called? If you look at your skin, you see something like oil, and you're like, oh, I have an oily skin. What is that oily substance? What is this called? It is called sebum. Sebum. So it is called sebum. That oily substance is called sebum. And my question for today is, another name for pap test is what? Yeah, Mommy T and V ever MCG. I just finished talking about pap test or pap smear, and I said it's gotten from the name of the physician doctor. I said physician doctor, from the Greek physician, the doctor Papanicolaou, just Papanicolaou. So he was the one that invented this way of detecting cancer, cervical cancer, and the test is called after his name, PAP test. So this test is used to detect cancerous cells in women, precancerous cells and cancerous process in the cervix of women. And I said when it is detected on time, that is very good in altering the process, and the test is not that painful. It's not that painful. Mommy T and B, when last did you have a PAP test? Ever MCG, when last did you have a PAP test? Lizzie Love TV, when last did you have a PAP test? Wow, very interesting. So it is not painful at all, but it is mildly uncomfortable, I must confess. And my gynecologist did a good job. She was actually discussing with me while carrying out the test. I didn't even stay long at all. With the whole COVID-19 thing, there was not so much people around. I just sat down there. She called me in. Within 2, 3 minutes, we were through with the test. You understand? So the results of eventually we get back to you whether it is positive or negative. So I'm going to be uploading this right away. And we're in November now. So please, for my December editions, I would like to make it an open file. So if there's any 2 years ago, Mommy T, I'm okay, you are still on track. You don't need it for now. So for my December editions, if there's any topic you want me to take, you understand? If there's any topic you want me to take, please let me know. You can leave the comments with me in the comment section. I'm going to collate all the topics together this month ending, so that by December I take those topics. You understand? I might need to also invite some of my friends, my medical doctors friends or nurses. We could treat the topics together. December is going to be a wonderful edition. December is my birthday. Hey. So December, we are going to have lots of beautiful editions in December. If there's any topic you want me to take, please let me know in the comment section before December, so that I can arrange everything, and then by December I take those topics. I've already gotten one topic already from Africa Choice. Yeah, she said I should come and take 40 questions. She tagged me 40 questions. Wow. I'm not an extrovert anyway. Wow, happy birthday in advance dear. Thank you so much, Gifty. I'm not an extrovert. Oh, I have 2 minutes introduction video already. But African Choice is saying we want to know more about you. Come and answer these 40 questions. So I just have to do that. So I've gotten the very first topic already for December. 40 question tags. I should come and answer those questions. Okay, I'll come and answer the questions. All right. Thank you so much. So if there's any topic you would like me to take in December, let me know before December in the comment section. Thank you so much for coming around. I appreciate you all. Temitope Modupe Father Onsi. Thank you. Mercy, thank you. Olaoluwa, thank you. Fantastic Epeepe, thank you. Gifty Daily Motivations, thank you so much for coming around. Mommy TMV, thank you, ma. Thank you, ma. Eva MCGU, thank you for coming around. IJ Kitchen and Health Channel, thank you so much for coming around. The necessity of practice and my personal experience. Wow, it wasn't painful at all. It wasn't painful at all. Thank you so much. Thank you, everyone. I appreciate you. Pressing and also turn on the notification bell. And after turning the notification bell, please endeavor to press the word all again, so that you could get all notifications anytime I upload. Thank you so much. I appreciate you honoring my invitation. Thank you so much. Have a wonderful and a blessed weekend. See you soonest. See you soonest. If you know anyone around you, no matter how, these girls that are promiscuous, please tell them to stop it. And as a matter of fact, they need to start going for PAP test because, you know, like I said, HPV virus is transmitted during intercourse. So you need to encourage them to stop it because they are inviting cervical cancer by themselves. Thank you so much. Even some elderly women too could be promiscuous, 65 and above, changing men, carry these young guys. Please encourage them. Cervical cancer is real. Cervical cancer is real. Keep your cervix clean as much as possible. Keep your cervix pure as much as possible. Thank you so much for coming around. See you soon. Bye. Bye bye. Thank you. I love you. Thank you. Thank you. Bye bye.